Well, and I first was introduced to the idea of becoming a physician as a small boy. I decided I wanted to be a doctor about 3.5 years old. My grandfather and uncles were doctors. My great grandfather was actually the only Jewish czar physician to visit Russia, as long as he lived. So I had a long history of it, but both my relatives were practicing Orthodox medicine. But I really fell in love with medicine with my grandpa. He used to take me around in a Studebaker for house calls with his patients. Um, I first got introduced to alternative medicine during the 60s and 70s, during the human potential movement, when East meets West. And I read my first holistically oriented book, which was John Lust's Herbal Treatise on naturopathic medicine, herbal medicine, when I was 17, and began collecting herbs and experimenting with things and growing them in my bedroom from that point on. So I was hooked and began studying all kinds of naturopathic medicine and read Felix Mann's treatise on and internal medicine and the Ching and in my first year of medical school. And I decided by my first year of college, I decided after 2 or 3 years of college and studying all different kinds of alternative medicine that I knew I was going to go into a more comprehensive field of medicine, either traditional medicine or Ayurveda comprehensive and treating the body, the mind, and the spirit. And I saw allopathic medicine as only winning one sliver of the whole spectrum. And it was in my first year of medical school that a group of other students and myself, we created a study cell, underground study cell, and we brought different kinds of practitioners to our school, both TCM practitioners and Ayurvedic practitioners. And it's when I brought Dr. Bill Gray, who was really eventually would be the father of the Renaissance of American homeopathy, to Stanford to speak to our study group, that it really changed my life. I saw this comprehensive Western system of medicine that subsumed all of herbal medicine, but it was bioenergetic at the same time. It was really quite amazing. And I did a preceptorship with him between my first and second year of medical school for 3 months intensely, and it changed my life. I knew that's what I wanted to do. So I've been studying homeopathic medicine along with nutritional therapy and naturopathic medicine since about 1975, pretty actively, and practicing it since then and integrating it into my MD practice. And essentially, although I have an allopathic medical degree, I really do naturopathic medicine and homeopathic medicine predominantly. And my main goal is to get people off allopathic drugs and to help them avoid allopathic medicine as much as possible, and only to use it when they have to. I guess if you were to categorize practice, it would be true integrative CAM, integrative complementary integrative medicine. I use the best of both worlds. I predominantly use classical homeopathy because I find it to be the most effective medicinal system of medicine in the world from a bioenergetic standpoint. And I individualize that as much as possible. And I use nutritional therapy, herbal therapy as a supportive foundation to nourish the cells. And I find the best approach to get people off of all of the suppressive allopathic drugs. And I've become sort of the default physician in my region of Virginia in the southeast, the Mid-Atlantic states, for treating patients with cancer and autoimmune diseases and severe disorders. And I often treat a lot of doctors' families, mostly because other doctors were afraid to do what I do, but I'm not, because I've been doing it for such a long time and I see that it works, so I feel pretty confident in doing it. And I train a lot of other doctors. I really enjoy teaching and doing that. And I'm just going to make sure that homeopathy and nutritional medicine survive. I've got